Hello, everyone. Thank you so much for joining us on this program today. Our program focused on African women's health. This is a program that is committed to promotion of African women's health at home and abroad. We share the global message of health for all and continue to emphasize that African women must not be left behind in optimal health. My name is Dr. Olaide Ogunshiji of the School of Nursing and Midwifery, Western Sydney University, Sydney, Australia. Last week, our focus was on tobacco use and African women. Today, we'll be looking at the issue of depression. Depression is a common mental illness that is characterized by persistent sadness and a loss of interest in activities and subsequently an inability to carry out daily activities for at least 2 weeks. According to World Health Organization, as many as about 300 million people are living with depression. More women are affected than men. And we consider the burden of depression and other mental health condition that is on the rise globally. There is a suggestion that an urgent need for awareness of this health issue is very important. A number of causes have been suggested for depression, and these include a complex interaction of social, psychological, and biological factors. Adverse life circumstances, such as unemployment, traumatic life experience, bereavement are also considered as important factors that are associated with depression. And depression in itself can lead to more stress and dysfunction and worsen the affected person's life circumstances. A number of physical health issues as well, such as heart disease, cancer, and diabetes, also have the tendency of making people to be depressed. What are some possible symptoms that come to mind? With depression, you have symptoms such as loss of energy, change in appetite, sleeping more or less, anxiety, reduced concentration or indecisiveness, restlessness, feelings of worthlessness, guilt, or hopelessness, and many times associated with thoughts of self-harm or suicide. Depression can be categorized as mild or moderate or severe, depending on the severity of symptoms. There is recurrent depressive disorder as well as bipolar affective disorder. With recurrent affective disorder, you have the instances of repeated episodes of depression. During these repeated episodes, there is the issue for affected individual to experience low mood, loss of interest and enjoyment, reduced energy, and all other symptoms that have been previously identified and spoken about as symptoms for depression. Meanwhile, with bipolar affective disorder, affected individual experiences both elevated and depressive moods with some experiences of normal moods in between. Some treatments have been suggested as effective for depression. Some of these include the talking therapies, and those therapies that involve talking and discussion, allowing affected people to talk about their experiences. And some of this can be in terms of one-on-one or even in a group situation. There is also the use of antidepressant medication. And thirdly, a combination of both talking therapies and antidepressant medication. A number of these treatments have been found effective. However, despite the availability of these effective treatments, evidence shows that people living with depression only half of them receive the treatment. Suggested barriers to receiving the treatment include lack of available resources, lack of trained healthcare providers, some myths, and stigma that is associated with mental health disorder, as well as inaccurate assessments. And some of us that may be listening to me this evening will be able to relate or find some of these barriers as relatable to African women at home and abroad. Let's look at this a little bit more closely. For African women in Africa, there are usually issues of lack of resources and trained healthcare providers. For example, in a current study that we conducted in Koranko community in Sierra Leone, all the 16 young women aged 18 to 30 years who took part in face-to-face interviews expressed an ongoing feelings of worthlessness and hopelessness for being women. And as you may be able to guess, none of them is seeking professional assistance for this, and practically there is actually none of these resources available. For African women that have migrated to Western countries, even though there are resources available in those Western countries, what we find is the issue of cultural myths and social stigma associated with mental health illness that are key barriers to their access to those available resources. And I quickly want to cite another example from one of the studies that we've conducted among West African women that are living in Australia. Findings on their health-seeking behavior revealed that a number of them considered that only psychotic or mad people need to seek assistance with mental health issues. Having said this, there are some prevention programs that have proven effective, and these include, number one, school-based programs that are aimed at enhancing a pattern of positive thinking among children and adolescents. Also, exercise programs for the elderly has also been found to be proven to be effective for prevention of depression among the elderly. There are other possible prevention strategies that you and I can practice in preventing this mental health issue. Number one is that of talking to someone. If you are feeling low or overwhelmed by circumstances that surround your life, please talk to someone today. You can go for a walk. Furthermore, you can also personally take an inventory of things that are going well or things that you have. Keep an inventory of those things that you have, as well as the ones that you don't have, and compare the list. You will likely discover that there are much more on the list of what you have than what you don't have. For as long as these lists are found to be long, for those the ones that you have, we encourage you to practice taking this daily inventory. And as you do, be grateful for the long list of what you have. And this is where we're going to end our discussion today. I would like to thank you so much for being there and for being part of this program. In case you are wondering who you are watching or listening to, this is Dr. Olaide Ogunshiji of the School of Nursing and Midwifery, Western Sydney University, Sydney, Australia. Until next week when we meet again on this program, focused on African women's health, I would like to say it's bye for now. Thank you very much.